Welcome back to the OHSU Effect. Healthcare has changed a lot over the years, thanks in part to technology and advancements, but also due to how doctors deal with patients. With me now on the OHSU Effect is OHSU Medical Director, Dr. Chuck Kylo. Good morning.
Morning, Lacey.
Okay, you've been involved in healthcare improvement for almost 20 years now. So what has gone well, and kind of describe some of the changes that you've seen over the past 2 decades?
Great question. What's gone well, I think, is that we have really gotten healthcare interested in quality. It's taken a long time to educate the industry, perhaps longer than we would have anticipated. But as you know, it's an incredibly complex industry with lots of really detailed things that happen, complex surgery, lots of other things like that. Every individual is different. So it's taken us really 20 years to really get people to understand quality and how to improve it. And I think that's actually gone well. And so I think we do today have a very different level of awareness about what that means than we did, say, 10 or 20 years ago.
What would you have liked to see gone better?
I would have liked to see that happen faster, more quickly. So I'd like to be where we are today talking about the depth of healthcare reform that we need to get to 5 or 10 years ago. We're doing it now in the face of a financial crisis, both a national crisis and a state fiscal crisis. Which in many ways is forcing our hand, which I guess is a good thing. On the other hand, it would have been better to have done it in a time where we didn't have as much financial crisis. And so that would have been preferred. But we are where we are, and I think we have the skills now and the knowledge to really drive substantive improvement in healthcare services. Talk
some more about the ways in which healthcare has transformed since you started seeing patients.
Well, I think it really hasn't transformed as much as we need for it to do so. At OHSU, we are driving transformation in a lot of different ways. Telehealth and telemedicine are one way. So in the past, as you know, it's really required individuals, we sometimes call them patients, to travel from areas to us when we know full well that it's very easy and possible, we could do it in a high-quality way and safely, for us to deliver knowledge to the individual. Right, so it's our pushing knowledge out instead of the individual having to travel, park, wait in the waiting room, all that sort of stuff. So I think that sort of telehealth is one really key example of what transformation will look like.
What's missing from healthcare reform today?
I think what's missing is a much deeper level of cooperation between health systems. So the lack of cooperation, or stated differently, the competition between health systems. And we're used to thinking about competition being good in our lives, and I'm a big believer in competition. But competition in healthcare has really led to a very, very expensive duplication of resources, and it is one of the key drivers of cost increases. And so I think we need to learn to work much more effectively across health systems to serve our population in fundamentally new ways that is much more cost-effective and provides a higher quality service than we currently provide.
Do you think there needs to be some sort of incentive there for health systems to start working together?
Well, I hesitate to say that because the incentive really should be the health of our community. And we need to get money out of healthcare and back into the pockets of employers and really employees. And we need to do that because we need a much better employment environment in Oregon and really around the country. And what we do know is that healthcare is really crippling in many ways, our employment environment. And that's a very dangerous place for us to be.
You talked about telemedicine and telehealth. So talk more about the method of the way that patients and doctors communicate and how that's changed and how that's changed healthcare in general.
Right. So in my practice, I've been doing very robust e-care, email care, and phone care for, well over a decade now. And once I have a relationship established with somebody, I'm a primary care physician, a personal physician, and I take care of adults. And I would never do sort of the depth of phone care, email care that I do without knowing somebody first and without having their history in my records, right, which are electronic and I can view from home or wherever I am. But once you have that relationship and once you have that background, I can provide care to people irrespective of where they are in the world. And I've taken care of people who lived in Mexico City, who lived in Singapore. Now, they were at some point based in Portland, and so I got to know them, established a deep relationship. And once that happens, we can provide care to them no matter where they are. Sometimes an emergency happens and they need to go to the local emergency room or stuff like that. But most of the time it's advice. And most of the time it might be an adjustment of the medication that they're on or something like that. And so that's, I think, another example of how healthcare is and needs to continue changing to make the whole process much more efficient.
What are some of the initiatives at OHSU to improve the patient experience?
Well, it's a great question. Certainly telehealth and pushing using the relationship as the mechanism of care, which allows us to push knowledge out and to interact with people in non-face-to-face ways, is very important, particularly from the ambulatory care perspective, outpatient medicine. From the perspective of the hospital, service quality and the patient experience in an academic medical center is always a fascinating thing because we have a lot of learners in the environment. Right? We have residents in training, we are doctors in training, and then we have all of our faculty physicians. We have nurses and our nurses in training. So we have a lot of learners in the environment, which is of great value to the community because we need those people. We need nurses. We need to produce nurses so they can go work in the community. Same with our physicians. And it creates a very interesting environment in the hospital because the individual, the patient, is exposed to a wide number of care providers, many of whom are learners. And so we have to improve service in the face of all that. And there are lots of different ways that we're working on doing that by helping for the patient to know who those providers are and remember that more effectively, to improving communication styles and things along those lines.
There's a big focus now on preventive health. Tell us why and what physicians are doing in that regard.
Yeah, so I think hopefully as a community, we are increasingly focused on not just the delivery of healthcare services, but on in the early stages of a much deeper conversation about how we build wellness and health into our communities and into our interactions with our physicians, in this case, preventive services, right? Whether it's breast cancer prevention or colon cancer or prostate cancer or basic cardiovascular health. And so there is, I think, a fundamental and ongoing shift towards that kind of care. The best care that anybody can get is health when they don't need us, and that we should strive for people not to need us, right? And that requires that we do things differently in the office, and it also requires that we interact with our community in a different way. And we have folks who specialize at OHSU in public health kinds of efforts and the design of cities and interacting with communities to understand the health issues that they're struggling with and how do we help them sort of at a community level.
Healthcare reform is, a huge political topic these days, but one thing that we don't hear a lot about is the impact on patients. What do you expect here?
Well, I think the most important part of healthcare reform is that we know we need to decrease the cost, and we know that we need to give a lot more people, really everybody, access to high-quality healthcare services. And it really shouldn't be a political issue. This should not be a right or left, conservative or liberal issue. Health really is a public asset. And if we don't deliver health to our community, then it becomes increasingly expensive for our community. It becomes a less good place to employ people. So health, in the general provision of basic healthcare services, I wouldn't get into moralistic terms about is it a human right or anything like that. It's just a smart way to run your society and your community because it's less expensive. And so I think that the debate needs to be really on that. How do we deliver a consistent, high-quality set of basic health services to everybody, which includes rapid access and high-quality service, so a good experience of care, so that we can produce a healthy community. And a healthy community is a less expensive community than an unhealthy community.
Let's look in your big crystal ball. What are the big health problems that you're concerned about in the future? And specifically, what is the biggest threat to Oregonians?
Well, I think the biggest threat across the country is the expense of health care. And the more expensive health care gets, the fewer people can afford insurance. The less they can afford insurance, then they ignore preventive care. They end up waiting until they're very sick and then going to the emergency room, which is an incredibly expensive way to provide care. So the current trajectory and the expense that's built into the system creates all kinds of a sort of poor design of the system that really doesn't achieve community-based health, which is really what we're after. I think that's the biggest challenge that we face.
OHSU Medical Director Dr. Chuck Kylo, thank you so much.
Thank you, Lacey.
More of the OHSU Effect coming up in 5 minutes.